Hey there! Today, let's dive into a critical topic that every nurse needs to master: handling cardiac tamponade emergencies. Cardiac tamponade is no joke. It's when fluid builds up in the pericardium, the sac around your heart, causing decreased cardiac output and can be fatal if not treated ASAP. So, how do nurses manage this? Let's break it down. First off, initial assessment and recognition. You need to monitor vital signs closely. Keep an eye on blood pressure, heart rate, respiratory rate, oxygen saturation, and temperature. Look for signs like hypotension, tachycardia, and pulsus paradoxus, which is a drop in systolic blood pressure during inspiration. In your physical examination, watch out for Beck's triad, hypotension, distended neck veins, and muffled heart sounds. Other signs include tachypnea, chest pain, restlessness, cyanosis, and decreased consciousness. Next up, diagnostic testing. Echocardiography is your go-to tool. It shows fluid in the pericardial sac and assesses its impact on heart function. An ECG might show electrical alternans and low-voltage QRS complexes. A chest X-ray could reveal an enlarged cardiac silhouette if the effusion's big. Now, let's talk emergency interventions. Start with oxygen therapy to improve oxygenation and reduce myocardial workload. Administer IV fluids to maintain blood pressure. The definitive treatment is pericardiocentesis, aspirating fluid from the pericardial sac with a needle. Nurses prep the patient and equipment, monitor during the procedure, and provide post-care. For pharmacological management, inotropes like dopamine or dobutamine might be used to support cardiac output. Analgesics and sedatives like morphine or benzodiazepines can relieve pain and anxiety. Post-intervention care involves continuous monitoring of vital signs, oxygen saturation, and hemodynamic status. Watch for complications like recurrent tamponade, infection, or bleeding. Educate the patient and family about signs of recurrence and the importance of follow-up care. For long-term management and prevention, treat the underlying causes such as malignancy, infection, or autoimmune diseases. Regular follow-up echocardiograms might be necessary and ensure the patient adheres to prescribed medications. Let's look at an example case. A 65-year-old male with a history of lung cancer presents with shortness of breath and chest pain. Initial assessment shows BP at 90/60ths mmHg, HR at 120 BPM, RR at 28, and SPO2 at 92% on room air. Physical exam reveals distended neck veins, muffled heart sounds, and pulsus paradoxus. An echocardiogram shows a large pericardial effusion with signs of cardiac tamponade. The ECG shows electrical alternans. Emergency interventions include 4L/min oxygen via nasal cannula, IV fluids to maintain blood pressure, and successful pericardiocentesis, aspirating 500 ml of bloody fluid. Post-intervention care involves continuous ECG monitoring and frequent vital sign checks. Watch for fluid reaccumulation or infection. Educate the patient and family on recurrent signs and the need for follow-up care. For long-term management, refer back to oncology for further cancer management, schedule follow-up echocardiograms, and advise on medication adherence. In summary, nursing management of cardiac tamponade involves prompt recognition, emergency interventions, continuous monitoring, and addressing underlying causes to prevent recurrence. Nurses play a crucial role in stabilizing patients and ensuring comprehensive care throughout the treatment process.